Chicago has been hit particularly hard in the opioid epidemic.
I worked with a lot of patients who had substance use disorders, and it was through that experience that I came to understand that these are patients who often suffered a lot of pain, prior trauma. They may have untreated mental illness.
In our emergency department, we see many patients who are at risk for overdose. And knowing that, we work to develop a protocol to start doing opioid overdose education and naloxone distribution for our patients.
The Pritzker School of Medicine provides students with the opportunity to select one or more electives to take during the spring quarter of their first year.
Addiction and substance use disorders are not something that are covered in the preclinical years to a great extent. It's something that students don't generally get a lot of exposure to, so there's a lot of value in approaching this topic with students early on in their medical careers.
We were able to provide didactic training for students on opioid use disorder and really train them to engage with this specific marginalized population.
Students are also able to get some direct clinical exposure working with patients. And as a part of this, they also get some exposure specifically to talking to patients around more sensitive topics. And I think there's a lot of value in that because it can be challenging to talk to patients about very private, sensitive issues. And the earlier students get exposure to that, the more facility they'll have with that as their career moves forward.
I think ultimately the impact of this innovation on undergraduate medical education here at the Pritzker School of Medicine was significant. We had students who were early on in their medical school training, still learning the foundational sciences, who were able to be educated on a public health crisis. They were able to engage with that patient population, and again, they were able to provide significant value to patient care.